In tonight's UpFront report, we're focusing on the drive to vaccinate people in our state in a timely manner to stop the spread of COVID-19 here in Michigan. Joining me now is the newly appointed Director of Michigan Health and Human Services, Director Elizabeth Hertel. Director Hertel, thank you for being here tonight.
Thanks for having me.
Let's begin with the appointment of your colleague, Dr. Jonae Caldoun, to the President's COVID-19 Health Equity Task Force. Will that do for other vulnerable communities in our country what's already being addressed here in Michigan through the Coronavirus Task Force on Racial Disparities?
I certainly hope so. Dr. Caldoun is a leader in Michigan and now in the country on making sure that we are considering racial disparities as we roll out our strategies for COVID response, both in testing and now in vaccination. And I'm so proud to be able to work with her.
Governor was critical of the Trump administration for the initial distribution of vaccines to states. The dashboard, the state's dashboard, shows we are getting more now, some weeks. Is it enough, though?
It's not enough. What we're seeing is a great demand for the vaccine, and we're very happy about that. But the amount that we've been getting in since December isn't enough to satisfy that demand. However, we've been working very closely with the Biden administration, and we expect those allocations to continue to increase as we move through the spring and in the summer.
When do you anticipate pharmacies in our state to start vaccinating people? And are you also looking at places like Ford Field, TCF Center, or Little Caesars to do mass vaccinations?
Absolutely. We have identified a number of sites across the state. TCF Center is one of those that has been set up. There are other large-scale arenas and other areas that are ready to go. We have the infrastructure there to do the mass vaccination sites. We also have over 2,000 providers who are ready to start administering the vaccine when we start getting the quantities in that will meet that demand. And I think that we have a really great infrastructure in place and ready to go when we see that quantity coming into Michigan.
And the pharmacies, and do you believe that'll be safe and an effective way to administer vaccinations as well?
Certainly, yes. We rely on our pharmacies heavily now to help us with our flu vaccination campaigns. So they certainly are poised as providers in their communities to help implement this COVID vaccine strategy.
And then let's briefly touch on the new variants. What's your level of concern here and the risk that that could spread quickly throughout our state?
Yes, we have identified the variant in a number of counties across the state. We are watching closely the close contacts of those individuals who have had the virus that is identified as that B.1.1.7 variant. Our hope is that people continue to mitigate their risk by that mask wearing, social distancing, that they are very aware of the risk, especially of the easily transmissible B.1.1.7 variant, and we will be able to mitigate widespread transmission of the variant.
Double masking, as recommended now by the CDC, helpful in your view?
Absolutely. Yes, very helpful. Making sure that people have that protection against the aerosolized germs that are the bacteria in the air is going to make a big difference and continues to make a big difference as we prevent the spread of COVID-19.
And finally, it's been a few weeks now since you were named to replace Robert Gordon. I've got to ask, were there philosophical differences within the administration that led to his decision and the change in leadership in the department?
I am unsure of Director Gordon's decision to resign and why that was, but I'm very honored that the governor has asked me to step into this role, and I'm looking forward to leading the department as we come through this pandemic and into all of our endeavors into the future.
Director Hertel, I appreciate your time very much tonight. Thank you for the information and the insight as this battle goes on and on in our state.
Thank you so much.
Elizabeth Hertel, Director of Health and Human Services in the state of Michigan. Still